Well, it's usually said that health is wealth, but as increased inflationary impact heightens and the cost of living crisis rages across the continent, affordable healthcare is gradually becoming a mirage. Now, access to affordable pharmaceuticals are more crucial than ever, but can technology play a pivotal role in addressing these challenges? In a world where digital transformation is reshaping industries, how do we ensure that technology serves not just businesses, but people? Of course, what role does tech play in building a sustainable future? This morning, joining us to talk about this is Okwuada, who is the CEO and co-founder of Remedial Health. He joins us from Lagos. Thank you so much for joining, Mr. Samuel.
Thanks for having me, Michael.
So how can technology drive sustainable social and economic change in Africa, particularly in sectors like healthcare, probably education, and equal infrastructure?
Good question. So technology is an enabler. A simple way to explain this would be to associate it with the leapfrogging Africa had a few years ago with mobile phones. So we literally went from NITEL, where you had to travel for phone calls, to a device in your hand. And we basically leapfrogged the landline sort of era. And that also brought you the internet era in using Nigeria as an example. So what technology does is it helps you to leapfrog. It helps you to go a bit faster than you would normally go.
But then what are the biggest barriers to technology adoption in underserved communities?
So biggest barrier, I would say one would be cost. In the past, I would say cost of device. Thankfully, today we do have smartphones, but still, compared to, say, the minimum wage, compared to what people in these underserved communities would typically make in a given month, the cost of device is still quite high compared to that. So that's number one. Then there's also the cost of data. Unfortunately, in the past few months, we've had this discussion about prices of phone calls and data going up in Nigeria. And that will just further compound the ability for these underserved communities to get access to the internet, which then provides that technology layer for delivery of healthcare services. So I would say major challenge would be cost, data, device, and then just the investment into doing this. So on one hand, we do have private companies that would invest in this sector or that invest in this sector, but you will find that the nature of health, especially in the underserved communities, needs the backing of government. There is an element of, I don't want to call it charity, but there is an element of that in the delivery of services to those kind of communities. So without that backing, it would also be a challenge to be able to serve those places, because profitability for the companies who are providing the services will be an issue.
So this would actually mean that, African governments are not really doing enough in investing in the continent's healthcare industry.
They're not, unfortunately. I would wish I was saying something different, but unfortunately they are not. On the bright side, I would say, thankfully this year, if I use Nigeria's budget as an example, we have an increase in the budget allocated to healthcare. I think for the first time, we have about 5%. But that's still very low compared to where it needs to be, which is 25%. Now, it doesn't also take into account the years of neglect. So the many decades of not investing into our healthcare sector, it doesn't take that into account. So it then looks like it's going to take us several years, first to correct the mistakes of the past, and then to catch up to where the world is today in terms of healthcare. So unfortunately, we're not making the investments that we should be. The thinking was that from COVID, we would have learned our lessons as a continent and as a country, and would have made those adjustments. But it seems we quickly forgot COVID and what happened during COVID. So, for example, countries preventing the export of gloves, medical gloves, something as simple as that. Countries like India, like China, where they're mostly produced and imported into Africa, block the exports of those because they needed it for their country, which is pretty normal. I would say if we were the ones, the government blocked it, I would say, yes, that was a good decision to make. But then it meant that we were at the mercy of aid, getting aid from other countries to be able to tackle COVID. Now, a lot of promises were made, a lot of things were said after that, but we haven't seen any of that many years down the line. So unfortunately, no, we haven't seen sort of investments that healthcare should be receiving across the continent. Nigeria is even in a better place compared to most other countries.
So now that we are not seeing government efforts in terms of support and investment in the sector, how do we now pitch the healthcare industry to attract the kind of investments that it needs to drive digital infrastructure growth and support healthcare innovations?
So I think first thing you need is the right policies to support those private businesses that want to come in. At the end of the day, entrepreneurs are always looking out for opportunities, right? And they're always looking to make a profit. So if there is an opportunity, they will be willing to go in as long as there is the right support in terms of policies, and then secondly, in terms of funding. So what you find is healthcare is not like your typical investment in, for example, a fintech, where you expect to sort of see some profit within 2-3 years. Healthcare is more long-term. You need funding that takes into account the fact that healthcare needs a lot of investments upfront, and then it takes a good number of years for you to start reaping the benefits of it. So we need especially those two things, and then private sector would key in and build out that infrastructure for the delivery of healthcare services.
So invariably, healthcare investments is quite expensive. We also understand that technology is equally expensive. So can African startups collaborate probably with global tech firms to fill in those voids and develop local cost-effective health solutions?
Oh yes, definitely. We already are seeing that across the continent, even with the low investment into the sector by the government. I hate to plug, but I'll use, for example, my company. We ensure that medicines get from suppliers to the customers or the patients who need them in the shortest time possible, ensuring that there are no counterfeits in the supply chain, because that's one of the biggest problems to solve in Africa. So in terms of companies coming in, there are companies, I would say ours is an example. There are online pharmacies today who can deliver medicines to the most underserved regions in Nigeria even today. The question still comes back to, are they able to do it profitably? Are the policies in place to help support those kind of business? That's all we need to see. Once those are in place, yeah, that should happen. Now, in terms of collaboration with global players, that again is already happening. We're seeing a lot of investors who are interested in the healthcare space in Africa. I would say, again, the barrier is their support from the government in terms of ensuring that those businesses can thrive and those businesses get the policies that are required to make them sustainable.
And definitely this would mean that policies will need to be fashioned around digital literacy and seeing how that can attract some sort of education, and of course investors will be able to plug into this to improve the value chain where we talk about health delivery to both served and underserved communities. Samuel Okwuada, CEO and co-founder of Remedial Health. It was nice talking to you. Thank you so much for your contribution.
Thank you very much, Jacob. Thank you for having me.
Of course, you're welcome.